Well, good morning. This is Debbie Gilbert here again today with IGOT Communities, and today I'm going to be talking about generalized anxiety disorder. As counselors, sometimes we refer to this as GAD, just as a shortcut, but it's diagnosable as a disorder if it's prevalent for about every day for 6 months. And some of the characteristics that we're looking at are very excessive worry, a lot of muscle tension, restlessness, fatigue, irritability, and sleep disorders. And so you may have several of these. Lots of times they go together all at one time. But before we understand what generalized anxiety disorder is, let's understand what it's not. So it's not just a normal tendency to get worried or keyed up or even stressed in times when you have unexpected events or emergency situations. And it's not that feeling that you get, or specifically that I get just before I'm going to be speaking to a group of people or standing up in front of a lot of people. It's not that feeling you get when you go to the doctor and you're expecting news that is not going to be what you hoped it would be. Or for younger people, it's not those times when you're going to take a big exam. So generalized anxiety, well, let's just say anxiety is normal and it happens to all of us. And it when it begins, anxiety just kind of gets in your system and you feel a heartbeat maybe a little faster. You may notice that you're breathing a little different. You may act in a way that's just really not exactly your normal stance all the time. But when we talk about generalized anxiety disorder, a disorder, then this is something that's not normal. It's not your normal anxiety that we all experience. It's excessive and beyond any normal anxiety that everyone experiences from time to time. And it's so excessive that it is diagnosable and it really deserves attention and treatment. Coming along with it, it is this constant or persistent worry of things that are going to happen, and it's just like a hamster that gets on a wheel in your head and it goes around and around, and no matter how hard you try, it seems like you can't stop it. Oftentimes it's paralyzing and it's filled with a lot of physical tension, a lot of muscle tension. It's that constant looking at the negative outcome of almost any situation. And it's the realization that worry is excessive, but for some reason you just can't stop it. So it's like you know it's there, but it's just beyond your ability to almost stop what you're doing. So if you're going to begin to help yourself with anxiety, then you have to know your own characteristics. And that's just the best place to start. So there's some questions that you could ask yourself. And one of those questions would be, am I able to distract myself and switch my thoughts of worry to something else that's more productive? So when it happens to me, do I have skills or tools so I can switch my thought process? Another question to ask yourself is, do I get overly upset or annoyed that's preventing me from completing tasks at hand? Am I able to go to work? Am I able to complete an assignment? Am I able to sit down and have a conversation? Am I able to go to the grocery? Or do I get so upset and overly worried that prevents me from doing the things that I need to do on a daily basis? Another question might be, am I able to release myself from the worry and just relax? Do I know how to just breathe or sit down and read a book or take myself away to a place that helps me to relax? Do I worry about things in a more exaggerated way than most people seem to worry about the same sort of thing? And do I worry and rarely ever reach a possible solution for what I'm worrying about? Finally, you may ask yourself, do I justify my worry by thinking, my gosh, this is a big deal and somebody's got to worry about it. So if nobody else is in the family is going to worry, I'm going to worry about it. So do we try to justify ourselves in the worry that we're doing? So if you answered yes to mostly all of those questions and you said, that's me, then you may have generalized anxiety disorder. And I would really recommend that you would seek help from a professional. Now, when you can't have peace of mind and you find yourself avoiding or prematurely like leaving an event, a Christmas event, or not going at all, and you really desire to be involved in that, then it's time to seek help. If you're not able to go to work, or if you go to work and you get overly anxious and you get into almost a panic and you have to leave work multiple times, that would be a time when you really need to understand you're being tormented by anxiety and you're being cheated out of some of life's most awesome pleasures and enjoyment. And it's really, like I said, it's a tormented life that you would be living. So over time and without treatment, there are other physical and mental problems that are likely to increase as you go on without treatment. Now, it's not uncommon to feel like, my gosh, I'm the only one who feels this way, or I don't know very many people who are just like me. But just so you know, there's 4% of the population that really struggles with generalized anxiety disorder. And so you really are not alone. So let's look at the components of generalized anxiety disorder. So we're going to look at thinking, the thinking component, the physical components, and the behavioral components. So one of the thinking components, the most obvious, is just this chronic worry that you can't stop. The physical components is a lot of muscle tension in your face, where you may clench, in your forehead, in your brow, in your fist, just overall this tension. And sadly, that can lead to a lot of problems such as fibromyalgia and other muscle-related illnesses. It can play havoc on autoimmune diseases such as Crohn's and rheumatoid arthritis. So it's just the physical things is just where you just can't relax. And then there's the behavioral components, like I said earlier, and that's when you begin to avoid things that you really, really would love to participate in, or you're really seeking constantly reassurance from other people. Now, when these things happen, they happen in a cycle, and the cycle can go almost like clockwise or counterclockwise. And so it can start with just some thoughts, worrisome thoughts about the future and about negative outcomes. And when you start having these thoughts, then these physical feelings will come on you. And part of those physical feelings may be just a rapid heartbeat. You may feel like you're having some angina, there's just this heart pulling tension in there, sweating, just profusely perspiring, and you can't stop it, flushing, where you just turn red or splotching all in your neck. Some of the other symptoms are just clenching your fists, clenching your teeth, all kinds of just physical characteristics. And then this anxiousness will cycle around into anxious behaviors, and that's where you try to prevent the negative thoughts, and so you just disengage a little bit. It may be that you pace like a lion in your house, going back and forth, the wringing of your hands, bouncing of your legs, just because you started with some worrisome thoughts that were negative, you go into these physical things, and now you have these behaviors. So like I said, it can go around the other way. It can you can start with some behaviors and then come with all this physical feeling. Now, if you have these feelings and you don't learn how to get control, they can get worse and develop into what we call panic disorder. And that's where you get so anxious so quickly and you feel so flooded that it overtakes you, and it's very hard to take control back once you get into a panic attack. So let's just look at worry just a little bit. So excessive worry or distorted thinking is about something, usually something negative, that may or may not happen in the near or distant future. And you can worry over good things. You can make a great thing very worrisome, but let's say it's going to be the greatest day of your life and you're going to get married. You can turn that into a completely negative day by worrying about what may or may not happen. We know that about 95%, say, of the things we worry about really don't ever happen. Now, when we're overestimating our worry, that we sometimes do this thing called likely. It's likely to happen. And for senior adults especially, I've seen a lot of anxiety during the coronavirus pandemic, but some thoughts that I'm likely to get that would be, I will be the one. I'll be the one who gets the coronavirus. Or, you know what? I'll be the one who goes to the store and won't be able to buy toilet paper. I'll be the one who gets kicked out of my apartment because something will happen and I won't have the money to pay the rent. I'll probably be the one. And then you can go to a more severe case of it. And when you go to a more severe case, you add another adjective. I will be the only one. I'm the only one that this has happened to. I'm the only one who wasn't able to get toilet paper. I will be the only one who loses their apartment. You know what? Probably I'll be the only one who gets it, and I'll be the only one who dies. I'll infect my whole family. In fact, my whole family will probably die. And so we call that overestimating to a severity, and it never leads to anything good. So chronic worriers imagine the very worst case scenarios in every single situation. It's not what they worry about, because we all worry about the pandemic, but it's how that they worry. And so when we're looking at 3 beliefs of chronic worriers, one of the beliefs is that life has to be perfect, or I have to be perfect. I should not make any mistakes, because if I do, if I make a mistake, if I'm not good enough, I won't be loved. I will be judged as a complete failure. I can make one mistake and I'll be judged as a complete failure. And so perfectionism is one belief of a chronic worrier. Also, this over responsibility I mentioned earlier. Well, if I don't worry, I'm not being responsible. It's my responsibility to worry. It's my responsibility for my family. It's my responsibility for my adult kids. So I have to worry. And then here's one, and I would imagine even for myself, if I'm being overly anxious about something going on in my life, it is this third belief, and that is this unaware, sometimes demand for control. I'm in charge and I'm responsible for certain people, places, and things. Therefore, I must make it happen, and I must make it happen the way I think it should happen. And so there's a habit that we have of, there's a habit that I have that is, okay, so if I want this done right, I might as well do it for myself. I'm going to do it myself. And then what happens, you become overwhelmed with all these responsibilities, which only cycles around and causes greater worry. Now, we talked a little bit about physical responses, and so we do know that some of those physical responses are muscle tension, irritability, sleep disorder, just unable to relax. But that leads into greater problems. It leads into respiratory and breathing problems. It leads into cardiac problems, stress on your heart, and it leads into a lot of gastrointestinal symptoms. And with that, it's like, I can't breathe, and that I'm having a heart attack, and I'm having diarrhea, or I'm having constipation, but it leads into all kinds of other symptoms that can cause us a lot of problems. Now, the behaviors or actions that result from distorted thinking are one of the biggest. It causes avoidance of people, places, and things, which reinforces even more distorted thoughts. It causes us to demand over reassurance, and that is being overprotective of loved ones or becoming an annoyance to friends and family. And I always think about, and this is kind of sad, but I've seen this happen time and time again through my counseling profession, that people with a lot of high anxiety become almost like leeches to their friends and families, because when you're around them, they're so anxious and everything is so negative, and they're just wringing their hands, and they feel so paralyzed, and they want to be with you, they want to be reassured, or they want to reassure you. Well, if you go down to the south in the muddy Mississippi in the bayou, and let's say you're going down there and you're fishing, and some fishermen have told this story that they get in the water and there's a worm, a leech, that will get onto the body, and it's just got this little suction mouth, and it'll suck onto your skin, and it begins to suck the blood out of you. Well, it's sucking the life out of you, and the only way for them to get the leeches off, because they're stuck on there through the suction, is they'll cut them off at the neck, and then the mouth will fall off, and they leave. And for people who, it's sad, because people with a lot of anxiety, they love the people that they're with, but they have become so overprotective, or they have to be so reassured, that they suck the life out of people. And so when people are coming to me in counseling, that's one of the things they say: I'm killing my family because of what I'm doing, and this is killing me. And so learning how not to be with people without sucking the life out of them is a big deal when you're recovering from anxiety. So you have lots of loss of relationships because either you avoid them or they begin to avoid you. Another thing that happens with anxiety, sometimes people will fail to seek medical attention they need because they are afraid to be in crowds, they're afraid they're going to get germs, they're afraid of the news they might receive, and so they simply don't go to the doctor. Then there's the group who have anxiety that go to the doctor every single day. Why? Because they feel like they're having a heart attack, or they feel like they can't breathe, or they feel like they have cancer, but they keep having diarrhea, and they dream up every unimaginable and imaginable thing that they possibly can. And so some people fail to seek medical attention they need, and others really seek constant medical attention. Another thing that happens is people with anxiety will develop harmful self-soothing behaviors, such as drinking too much, or using drugs, over-the-counter drugs, prescription drugs, or illegal drugs to medicate themselves. Some people in their anxiety will develop bad habits, but it's soothing, and that would be things like overeating, or not eating enough, or watching pornography, or there's just a whole host of ways that we will try to soothe ourselves to relieve the trauma and the pain that we're feeling through the anxiety. So another thing is you can have a loss of income, because if you have a lot of anxiety, you try to go to work, you can't, then you lose income. Then a lot of people will get into such a state that they'll try to get disability for anxiety because they feel like they can't socially function with anxiety. Well, a problem with that is they may qualify and get a monthly check. but they're going to be locked in to a certain amount that the government decides that they can give them for this illness. And it's never going to be enough for them to enjoy the things that they want to enjoy in life. And so then it becomes even more anxiety because they may try to work on the side to supplement that very little or income. And in fact, the income will keep them in the poverty class. So they may try to work to supplement that. And then you have all that anxiety. What if I get caught? What if I lose this? Or what if I get better and go to work and then it happens again? So there's a lot of loss of income that happens with anxiety. One of the greatest things and the saddest things for me to see is when somebody loses their self. They become so anxious that they lose their self-esteem, and eventually they lose who they really are and who they want to be. So there are some treatments for anxiety that I want to mention to you. And one of the first is to become totally self-aware of yourself. And that means you become your own observer of your own anxiety. You begin to record and journal about your anxiety. So if you want to get better, the first thing you have to do is to study yourself. The next thing, and one of the most effective things, even more effective than medication, is learning relaxation breathing and progressive muscle relaxation. So relaxation breathing is very simple to learn, but you have to really be aware of how you're breathing. One thing that happens when you get anxious is you tense up, your muscles tense up, but even your blood vessels tense up. And where the blood should flow easily through your blood vessels and veins, all of a sudden your vessels constrict, and now the blood's trying to push through. And that's where all that perspiration comes from, and that heart pain comes from, and I can't breathe it's from all that, your blood trying to press through there. But if you learn to breathe, one thing that does is dilate your blood vessels, and more oxygen gets in there, and then you can breathe a lot better. So in order to breathe, it's super simple. I'm going to show you really quick. I always tell people one of the first thing to do is just take a big breath, blow it out, and drop your shoulders. Then you're going to drop your jaw, unlock your jaw, close your eyes. Just close your eyes, sit there with shoulders dropped, and just sort of relax your neck a little bit. Then you're going to breathe in through your nose for about 4 seconds. You're going to hold that 3 or 4 seconds. You're going to blow out through your mouth like you're blowing through a straw. Just a slow, steady. So I'm going to demonstrate this. I'm going to do this 5 times. So here we go. I feel better already. Now, here's what happens. If you have severe anxiety, I tell my clients all the time, go on Amazon and buy one of those little oximeters, like when you go to the doctor, they put it on your finger to test your oxygen level. Just buy yourself one. It's going to be $19 to $29 probably. Buy yourself one. When you feel anxious, put that on your finger. Look at what your oxygen level is. Take it off. Breathe 5 to 7 times, exactly the way I've shown you. Put the oximeter back on. And what I'm sure you're going to find is that your oxygen level has increased and your anxiety has decreased. Okay, another tool, progressive muscle relaxation. And that is where you just tighten up your muscle as tight as you can, and hold it about 5 seconds, and then you just let it go. You can start at the top of the head or down at your feet. But if you start at your feet, you're just going to hold your feet in a real tense hold, and then all of a sudden just let it go. Then you're going to go to your calf muscle, tense that up really, really tight, hold it 5 seconds, and then let it go. You're going to come all the way up your body, all the way up to your neck, to your brow. You're going to do your arms, you're going to do your hands, and then let it go. It's called progressive muscle relaxation. Another tool is mindfulness, and this is just where you repicture your anxiety. So one of the easiest ways when you're anxious, I call it take 5, and that's to take 5 objects, look at those objects for about 20 seconds, and then you're refocusing your brain from the worry that it was on to an object. So sitting here in my room right now, I'm going to look in front of me and I see a ornamental pineapple on top of my refrigerator. And so I'm just going to look at that for 20 seconds and think about, it's white, it's gold at the top. My really good friend Dawn gave that to me. I just think about that. Next, I'm going to look over at a picture hanging in my room. It says, How to Really Love a Child. I had a great friend who gave me that when my granddaughters was born. I'm just going to really take that in for 20 seconds. Next, I'm going to look at a coffee mug sitting over on the counter. I bought those actually to match my kitchen, and drinking a lot of tea and coffee out of those mugs. And I'm really thankful for quiet times with tea, so I'm just thinking about that. I'm going to look over here. I've got a little pamphlet I printed out yesterday for another class I'm doing. Just going to look at the pictures on that pamphlet for about 20 seconds. Finally, I'm just going to look at a gift that's sitting in the floor here. A good friend came by yesterday and dropped this off. She said, This is something I think you're going to need for doing some of your videos. And, she means a lot to me. But I'm taking my mind away from the anxiety that I had and just looking at 5 things about 20 seconds. I'm reframing what I was thinking about. And then finally, the last thing I try to do is dispute the worry. And so what I do is try to define what am I worrying about? Identify specific thoughts that I'm having or predictions that I'm making about that particular thought. Evaluate the odds based on the history of it happening. So, okay, I'm worrying about this, but in my history, this really hasn't happened before. Even though it could, my history is that it hasn't happened. Or if it did happen, maybe it only happened one time in 100 times. So I evaluate the history. And then I picture what I want to happen. If it could turn out exactly the way I want it to happen. We have these expectations. And what would it look like if it turned out the way I wanted it to happen? How good would I feel about that? And then I'm going to rate the severity of it between 1 and 100. Okay, how severe is this? Not what I think may happen, but really right now in the moment, how severe is it right now in this moment? And then I'm going to picture myself coping in a good way with the worst that could happen. So, what if it happens? Well, it may not, but even if it does, how do I want to handle myself? How do I want to help someone else in that situation and what I'm going to do? And I think of all of the positive ways that I'm going to handle that situation. So, things that we can do for ourselves. Oh my gosh, don't I ever need this one? Stop staying late at work trying to be good enough. I work a lot of late hours. And is it I'm trying to be good enough, or I don't know. Sometimes I just think my dreams are so big it takes a lot of time to do it all. Stop over calling your family and friends to go over and over and over something that hasn't even happened and may never happen, or something that happened in the past that you can't change, or something that may happen in the future. But if you're going to call a friend, why don't you call a friend and just tell them presently, how you're doing and what their friendship means to you. So stop over calling, stop over texting your kids or your husband. Give them a break. Stop cleaning, or start decluttering. We know that clutter can cause a lot of anxiety to a lot of people. So some people just clean, and they can't ever get it clean enough. On the other hand, some people just are so paralyzed they need to get up and start decluttering. You know what? Stop washing your hands until they bleed. Just stop washing your hands till you make them bleed. You're going to be okay. Go to the doctor if you need to. You have a lump in your breast. You have a knot somewhere. You have potential pneumonia. You're having heart pain. Go to the doctor if you need to. But stop going to the doctor if you need to. Try to know the difference. Go for a walk every day. Say things that you're thankful for. If you want to get better, gratitude will give you back more than anything you could ever want. So start being thankful. Make a list of 10 things you're thankful for and put it on the refrigerator. And every time you go by, just look at those things and say, I am so thankful for that. Give yourself permission to say no. And in some cases, give yourself permission to say yes. So you may need to start saying no to a lot of things. On the other hand, when people invite you out, maybe you just need to say yes. And then laugh and smile all that you can. I love to watch funny movies. And so I spent a lot of time working so much that I didn't do anything like that. But I love to find things to laugh about. I love to find people to laugh with. So smile. I tell people that come to my office all the time, and I tell them there's a research project that says put a pencil in your mouth and hold it for 2 minutes, like this. After 2 minutes, take it out. And the study and the research shows that you're most likely to smile a lot more all day. So, thanks for just sharing these few moments with me. I understand anxiety. There's help for you. And at IGOT Communities, we partner with a lot of people who can help with anxiety. And so all you have to do is contact us and say, hey, could you send me some names and some places I can go to get help? Because we're here for you. It's who we are. It's what we do. Thanks for joining us today.